Hi everyone, and welcome to another brand new episode from Podcast with Wageda. I'm Wageda, and I'm thrilled to have you all with us today. For those of you that have been long-time listeners for our podcast, thank you for joining, and for our new viewers, welcome. And I hope that you're going to enjoy this podcast and all of my other podcasts. Thank you very much for tuning in. And without wasting your time, let's get started. Today's episode is dedicated to beauty, the aesthetic beauty, the beauty that gives you the confidence, the beauty that gives you the peace of mind, and the beauty that makes you believe that you're going to go to places. They said vanity, insanity, but Andre Gide came to say vanity is not insanity. Vanity is actually sanity, because he grew up missing the love, the hugs, the warmth. He gave it to himself and he loved himself. By him loving himself, he gave himself what we call self-care, self-love. It is not insanity and it's not vanity. Loving yourself and caring for yourself is something that makes you start your day, finishing your day with the best possible feeling and energy that anyone can ever have. Don't let anyone make you think otherwise. That when you go to a doctor or you go to a beauty salon, that you are looking after yourself because you love yourself that much that you are selfish. No, it's called self-love and self-care. Keep doing it and watch this episode with us, because our doctor today, our pioneer today, is actually one who specializes in giving some people back their confidence that they are seeking by visiting him. He is one of the most celebrated plastic surgeons in the UAE, I would say in the GCC, because he worked in other GCC countries. Today, we have with us Dr. Sanjay Parashar, who happened to be the chairman of Cocoona Clinics in Dubai. Dr. Sanjay has transformed lives of more than 15,000 people. He has given them what they visited him for, with his 29 years of experience, and him being one of the 100 most powerful people in Dubai. He's here with us. Let's ask him all the questions that we want to know. There will not be all the questions, some of them, but at least I hope I will cover one of the questions that you personally have. Without any further delays, let's welcome Dr. Sanjay together. Dr. Sanjay, honestly, I would like to start by thanking you for taking the time to be with us, and I need all of us here today. It's an absolute pleasure having you.
Thank you very much. I always love talking. Thank you very much. And I always love talking. Thank you. And it's a great opportunity for me. Thank you.
I promise you that the entire interview is going to be in English, regardless of the fact that you know how to communicate in Arabic. And this is one thing about Dr. Sanjay that all of you need to know. But you still need to take it easy on him, correct?
Yeah, absolutely. But I'm very comfortable when I'm in my consultation with Arabic. But I'm very comfortable when I'm in my consultation with Arabic. I don't.
Stick to English.
Just English. I don't. Just English.
Usually, we start by asking our pioneer why they chose their profession, because end of the day, it is a profession. So many of them said it's passion, it's the love. So for Dr. Sanjay, you specialized in giving human beings not just confidence, I would say boosting their morals, reflecting on their self-love and self-care by being one of the most celebrated plastic surgeons in the UAE. I would say in the GCC, because it's not just the UAE that you worked in. So why plastic and cosmetic surgeries?
So let's say Of course, I come from a family of doctors, so doctor was supposed to be our profession. So as a profession, I wanted to become a doctor because I saw my brothers and my sisters and everybody as a medical professional. Obviously, the passion for plastic surgery came a little later.
Right.
Now, while I was doctor, I wanted to learn more about body organs.
Yeah.
And I wanted to treat and repair and improve body organs. So I wanted a surgical field, not treat just by medicine, which is the medical field.
Yeah, which is a traditional medicine.
So that's why I got into surgery. Now, while I was doing surgery, I realized that, and my colleagues and my mentors realized that I would do things differently. I was more meticulous, and I had some special skills like using both hands to do surgery. So my mentor suggested that I should look into plastic surgery. Nice. That's when I got exposed to plastic surgery.
Right.
And when I started researching, I went to the Department of Plastic Surgery, and I see how the people were transformed from what they were to begin with.
Indeed.
It just developed that passion in me that I wanted to do the same.
So, Dr. Sanjay, you knew that you had what it takes because your mentor saw you working and doing things, and you had your motor skills that set you apart from everyone else, and he encouraged you to do it. So if I have viewers today that would like to become cosmetic surgeons because they have the same passion of working with the body parts in the way that will transform them, what would be your advice, and what traits would a human being have to be as successful as you are for being a cosmetic surgeon?
I think primarily the first thing that one needs to be a human, basically, because you're treating human beings. So you need to have that humanity, humility in you, within yourself, and a very compassionate attitude towards helping whoever comes to you. That's the primary personality that we need to build. Okay. Then obviously gaining knowledge is not difficult. Everybody gets that opportunity to read and go through universities and learn.
And study and take exams. Yeah.
If you want to excel, you need to do a bit more than what others are doing. You need to spend more time. You need to understand what you're reading. And that was how I got differentiated from others. Because I would not stop until I know what it is about. I would keep reading it. I would go and find references, look at different books to understand what exactly I've been told, or they're trying to teach.
Yeah.
Then it's development of the skills. And that is something that you can develop. We are not born with all the skills as a surgeon. We do have finer motor skills and all kinds of motor skills. And although I was ambidextrous, I wasn't using both my hands for everything. Once I was told that I could, I trained my hands. So I could do stitching with both hands. I could use scissors with both hands.
Okay.
I could do pretty much everything with both hands.
All right.
So I think it's putting that extra effort is very important. And I think everybody has that in themselves. They just need to bring it out. They need to just push beyond the boundary.
That is so good to know that anyone can, if they have the passion for it and they have the commitment to do it, they can achieve it and they can become as good and as helpful to maintaining the beauty as
Absolutely.
Dr. Sanjay right here. Speaking of beauty and speaking of vanity insanity, which is no longer insanity, Dr. Sanjay, the question here is, we know that there are certain surgeries that are highly sought after. But before we dig deeper into those surgeries, we say plastic surgery, then we say cosmetic surgeries. Are they one? Are they different? What's the difference so that everyone knows?
The biggest specialty is plastic surgery. So plastic came from a Greek word called plastikos, which means like plastic, which could be molded. You can heat plastic and give any shape. You can create a bottle, you can create a mug, you can create whatever you like with plastics.
Yes.
Same thing is true with human bodies. You can mold the human bodies. You can restructure, you can reshape different parts of the body. That's how plastic surgery became a specialty, which means you could repair, reconstruct, mold any part of your body.
Yeah.
Okay? But obviously, in the beginning, plastic surgery was more for people who had problems like diseases, cancers, or accident where they lost a body part. For example, lost their nose or lost their face, half of the face, or lost their
The
arms.
breast.
So plastic surgeons were reconstructing them
Yeah.
using different body parts. Obviously, they became so skilled that they could modify even a normal body part. So if a body part is normal with a little bit of variations which a person does not like, they could make it more proportionate to the rest of the body. This is called as aesthetic surgery, which is now known as cosmetic surgery.
Yes.
So actually the ideal terminology which we would prefer to call is aesthetic surgery.
Yeah.
But people understand it as cosmetic
Cosmetic.
surgery. So aesthetic surgery is for people who are normal, they don't have any disease, they have not lost any body parts, but they want to have a body part more proportionate to the rest of the body. So that's aesthetic surgery. Or now it's enhancement. Even if they are beautiful, they want to look even more beautiful. So they want to enhance a feature, want a certain type of nose or a certain type of lips or a certain type of body. That's also part of cosmetic surgery.
I will have to revisit the part of having that part proportionally correct because nowadays they want to enhance certain parts of the body that make them out of proportion at all, and the bigger,
Yes.
the better
That's
for
the
them.
sad part. Yes.
So you receive clients like this. You receive patients that want this.
A lot. That want this, that have already done it, and still want more. It's very difficult to understand the psychology of a person. Obviously, as plastic surgeons or cosmetic surgeons, we are also psychologists. It's our job to understand the motive of the person, what
Yes.
the person is looking for.
Yeah.
Why would that person want that enhancement? And many times it is because of lack of confidence, because of certain inhibitions that they feel, because of a certain body part they are not able to achieve, So that's fair enough. But there are times when they all look normal, they look good, but they just want it more. And they keep adding it. And the commonest thing which everybody has seen is the lips, which is the injection in the lips. And sometimes they fail to understand that now it's looking abnormal. But for them, it's still more beautiful. And they keep desiring it and they keep wanting it more. And this happens to many other parts of the body as well.
But Dr. Sanjay, if I am coming to you today, or I would come to you tomorrow to say, enhance this part and give me more and give me more and give me more, this would mean that I desire it because I know that it is desirable. And when it comes from a female, it's known that it will be desirable by male. She's coming, let's face it here. She's not coming because she wants to look just beautiful in the mirror. She wants to come more attractive and more appealing to male. So, or let's say she wants to look like certain celebrities that she knows they are desired by men. So would I say that the problem here is the woman who's coming to you wanting more and more, or the problem would also lie with the men that are subjectifying the women to go and do this to please them? Because if she doesn't enhance this and this and this and go over the top, for example, the fiancé or the husband or the boyfriend will start looking at others. So would you say that the problem here is shared between the two?
It's a sad part, but a lot of it, what you're saying is true. It is driven by, let's say,
Pressure?
Okay? And I would, instead of specifying gender, I would say sex, both genders.
Yes.
Okay.
Yes.
But having said that, many a times it's very interesting when, let's say, a lady comes with a large lips and she wants more filler, and I keep telling the person that no, it is not aesthetically good. It's not looking good. And I do sometimes have to tell them that maybe people may also look at it as abnormal. And this is when they say, it's not for people that I'm doing it. It's for me. I wanted it this way. So it's very interesting. So I see both kinds of patients or both kinds of people. One, they say, I'm not doing for anybody. I just want to do it for myself. But at the same time, I know there are many people who are doing it because they are pressurized. They are under pressure.
Yes.
Maybe nobody is pressurizing them directly, but they are under pressure.
Yes.
They want to look good all the time.
But here sometimes it's being pushed beyond good. It's for looking more like freaks than looking good, because proportionally you can look and you can see that it's wrong, especially when they overdo it. And I'm speaking about male and female in this. I have seen male that have gone over the top with it as well, especially the Texas.
The jawline, yeah.
Yes. They do it and then they want to go and do more and more and more, and then it leads them to actually, I think they do put implants here and get it there permanently instead of just going with fillers, regardless of how it suits them or how it doesn't. But if you know, as Dr. Sanjay, that it will suit them or not suit them, if it carries risks, do you try to convince them that they should not be doing it and they should reconsider, or you go with the flow so they don't go to someone else and pay the price?
See, half the time I actually end up saying no. Let's say if I see 20 people or 30 people a day, I actually, almost 50% I say no. Because many a times they are asking for something that will not look good on them, or that could be dangerous or risky for them, or that could have long-term side effects or after effects, which they are not aware at this stage. So I do end up. At the end of the day, I want to feel good. I want to feel happy that I have done something good for them. I will not be happy if I have done something under pressure, just for them to be happier, knowing that this could be a problem for them.
Psychological?
I wouldn't do that. Absolutely. Because I want to sleep peacefully.
How can you tell your patient that the problem that she's facing is a psychological problem and not an aesthetic problem?
So it does.
How do you address it?
So it does require a lot of explanation. Okay. Many times I make the environment very light, so it's not a very serious discussion with my patients. We talk and we laugh.
We're talking
and things.
beauty.
Yeah,
we
talk and laugh, and
yes.
I do tell them the aesthetics of the body. I do tell them what happens over a period of time to the body. Body is not a static structure; it changes over a period of time.
Definitely.
And
Definitely.
So we go through that a lot. And if I see that they are understanding it, I'm happy. If I see that they are no understanding, my mood changes. I become more strict with them, and I become more authoritative. That's where I have to change my position a little bit. Put my white coat on and be very strict with them. And I think we have to do that. And I think it's every surgeon's responsibility or every doctor's responsibility to make sure what their clients or their patients are doing is the right thing.
Ethically. It's not a business, it's a human being.
Absolutely.
And what would you do about knowing that they will go to another plastic surgeon to do it regardless of what you said?
Well, many a times it does happen, and I've seen that happen. They will
and they come back to you to remove or to
back. And I've had to redo it or undo it. Sometimes they're embarrassed to come back because they feel that, oh, I was told.
You said so?
And I've seen them actually after many years, and they said, Doctor, I wanted to come back, but I was shy because I thought, what would you think? I said, I will not think anything. Okay, you have done it. That's okay. That's past now. Now let's figure out how we can improve it and make it better now.
How we can fix it, here comes the part of doing, undoing. I'm gonna specifically speak about fillers. Sometimes you go to a doctor, you don't want to overdo it, but the doctor himself overdoes it. Okay, they overfill here, they overfill. I had a filler under my eyes many years ago. And the doctor who's done it, I researched her very well. And she's been doing it for 5 to 6 years, just specifically fillers under eyes for dark circles and hollow eyes. So she ended up doing a very good job. However, I think this eye, she injected it in the wrong area, so I ended up with the two eyes being non-symmetrical. This asymmetry is not there under my eyes, and I have to fix it with a concealer. When I went to many doctors in order to dissolve the filler, they advised me not to. Back then it was really big, like I got into a fight with Sylvester Stallone and I lost to him. But they said, leave it, it will go. Why is removing the filler, if it's overdone, why is removing it dangerous? What does it do?
So what happens is when the filler, when it's overfilled, the tissues stretch. Okay, they get pumped up like balloon.
Yeah.
And if I dissolve all of the filler, what will happen to the balloon? It just shrivels. And this is what can happen. It wrinkles.
Okay.
Particularly in an area like under the eyes. So under the eyes is totally different area than rest of the face. I would treat it totally different.
Yeah.
I would be extremely cautious in filling anything.
Yeah.
You know, and I keep telling the patient, do not expect the fillers to fill up the defect in one go. Okay? Take time. Do it step by step, because the fillers change in volume by themselves, by absorbing water. So if I put, let's say, 0.5 ml, it might look like 1 ml after some time, just because it has absorbed water.
Gotcha.
So one need to be aware of that, and that's why it needs to be, underfilled, then overfilled. But correction, as you said, is difficult, and trying to remove everything can be a problem, because that leads to depressions and that leads to wrinkled skin, and they get more upset, and it's very difficult to correct that. So many times what we do is we try to just moderately or mildly reduce it, and you can do that actually. An expert can do that. You can use an expert can do that.
Thank you.
You can use a specific medication in a very diluted form and inject it specifically.
In certain areas.
Just to dissolve the deeper part, not the, so there are these skills that is required to improve that.
Yeah.
But many a times I would do it very conservatively, and then ask them to wait and see the response, and then do it further if needed. But definitely never try to completely empty it.
So, Dr. Sanjay, as you are injecting the solution that you spoke about, the dissolving of the filler is going to take time in order to give you a final result. How long should a patient wait after trying to dissolve a filler to see a final result before going to dissolve more add more?
If you actually use a concentrated dose, it can dissolve just within hours. Okay. So what we do is we make it diluted, and we inject it deep. So it takes about 3-4 days to go down.
Okay.
So I usually tell the patient to wait for at least 1 week or 10 days before you come back and then, reduce more.
So this is for fillers like hyaluronic acid fillers?
Only for hyaluronic acid.
Okay.
Unfortunately, this technique doesn't work for any other type of filler. For example,
what are the other types of
calcium
fillers?
hydroxyapatite fillers, or bioacrylamide, which is not used anymore now, but there are still many patients who have had this done with permanent fillers. They're called as bioalcamide and polyacrylamide. These fillers cannot be dissolved. They either needs to be squeezed out. Okay. Some of the fillers cannot be squeezed out. Some of the fillers actually makes the tissue hard, like stone or like wood. So that needs to be broken down with a chemical compound called triamcinolone, which is a steroid basically, which helps to break down these particles. So apart from hyaluronic acid, it's a bit challenging to deal with other fillers.
So basically, if someone wants to go and do fillers, like if Wageda wants to go and do filler, it is best that I make sure I'm getting hyaluronic acid.
Absolutely, that is still the safest.
Okay.
At least you can deal with the problems.
And what were these fillers used for? Like, if it's that hard and that not easy to be managed, what was it used
So
for?
the problem is obviously everybody wants one-time solution, and they think once you have filler,
Yes.
it can last for the whole life.
Yes.
You know?
Yeah.
And that was the mistake. So what happened then? The industry also tried to provide these fillers to the doctors that could last longer, and at that time, I can understand that the doctors also did not know the long-term consequences. So it was injected.
So not many
And
studies were done
Not
to
many
cover
studies.
5
There was
years
no
of research.
absolutely no.
Got you.
There was no
Got you.
long-term research on that.
Yeah.
And because people were excited about having something more permanent, it was just rampantly injected. And then later down the line, after a few years, people started getting problem. And then it was abandoned. But there are still many people who are living with these fillers. Some of them we could take it out, some of them we could not.
Oh dear. Goodness me. How about the fat transfer? This is used as a filler as well, but it's fat from the body. How does it compare to hyaluronic acid in terms of everything?
See, scientifically, it sounds very appealing, okay, because fat, of course, it's a natural source from your own body,
Yes.
and it's your own autograft.
And it
So
can be
body-
stubborn enough to stay.
Well, it can be stubborn enough to stay where we don't want it to stay, but it is not stubborn where we want it to stay. So,
Yeah.
which means that when I graft a fat to a certain area, we can't be sure that all of that fat will stay. And that's the most unpredictability of the fat grafting.
Oh dear.
Although it sounds good, sounds very scientific,
Yes.
but when it is taken from one part of the body to be able to inject in the other part, there are a lot of variables involved. What happens to the fat when it comes out? When it is injected, how does it get its new circulation? How does it regrow back?
How
Is
does it travel?
Is something that still we have not been able to control it. Having said that, for certain situations, it's still a good material to use. You know, for example, let's say, for example, cheek. Yeah, cheek is a good area to use fat. Under eyes, probably not. I wouldn't say. After 25 years of experience, I would say I would be very careful in injecting fat under
Injecting
eyes. Because the
anything under
skin
the
is
eye.
so thin,
Yes.
you know, and
Yes.
fat will not be like a
And
liquid.
it's full of nerves hitting
Yeah.
the wrong nerve.
Yeah,
And it's
and the
gone.
fat is not like a liquid gel. It's like pieces. And the pieces could be felt as lumps. And it's very difficult to treat those. Same thing in the lips. I wouldn't inject fat in the lip. I would still prefer hyaluronic acid or fillers in the lip. You know. So for certain areas, fat is very good, but not for all areas.
So something that is easy to control, easy to maneuver, easy to overcome problems with, let's just stick to hyaluronic acid for now.
Yes. Yeah, but in a controlled manner, in a safe manner.
Yeah, definitely. Moving from the fat transfer to removing the fatty self, and I'm going to ask you a few questions about one of the most sought after plastic surgeries. And I would say, I can easily say it's the first because when I researched it, it came as number one.
It is absolutely number one procedure. And it's been number one for last, 40 years, 50 years maybe.
Yeah, that is liposuction. Hence, the fact that every single day you look online or you look at a magazine and you find something new, a new technology to dissolve the fat or get rid of the fat or. So how many types today, how many procedures can a person undergo for liposuction? And what are the most successful ones that you do and you immediately see the result and feel comfortable and feel confident about yourself?
Last 25 years, I have researched a lot. I have tried to understand technologies, what would work. On paper, it all sounds very interesting.
Yes.
That a particular ultrasound would travel through your skin and it will break your fat and the fat will metabolize, or a certain laser will do that. Unfortunately, my experience was it does not happen. The way that it is projected, the way that it is published, it's very unpredictable. All the technologies, let's say cryotherapy or or ultrasound or HIFU or any technology will have a very unpredictable response on the fat. And whatever response that happens is it just temporarily stops the fat from growing in that area, or it kills the fat and that fat stays there as a dead tissue. Sometimes it becomes like a lump. Sometimes it becomes like hard lump, which we call fibrosis. Although liposuction sounds surgical, but it's still the most predictable way of removing fat. Because once you have removed the fat is gone. And you can see the effect pretty early. Pretty immediately. So I would say after 25 years and 30 years of practice, liposuction is still the best procedure to remove fat, but not to reduce weight. It's not to make a person look slim. It's more to contour the body. And you cannot do it everywhere in the body. You can only do in certain areas of the body. There are safety limits to it.
Yeah.
UAE law has also established the safety limits that one cannot remove more than 5 liters in a person at a time. So we need to follow that safety limit as well. But as long as we are safe, it's pretty good procedure.
So it is measured by the liter, not by the kilo?
No, it's measured by the liters. Yeah. So when we take it out, it is measured in canister as liters. And 1 liter does not mean it's 1 kilo fat weight, because fat is lighter. So approximately, let's say a liter of fat would be about 600 to 700 grams of weight, depending on the type of fat the person has.
Depending on the area as well. So, Dr. Sanjay, when you have people that are coming to you, some people believe that because they're overweight, they do liposuction and then they move from size 16 to size 10. Is this doable?
So, liposuction as such cannot do that, okay? But there is a whole program that can help do that. Now, if somebody is struggling from weight, let's say if a patient comes to me and says, I am overweight and I need to get into a certain size, I would say, yes, it's possible, but it's not just me who's going to work on you. You are also going to work along with me. So we both will work together to achieve that goal.
Yeah.
And I will help them by, let's say, doing liposuction, removing the fat, by giving them lifestyle advices, by giving them dietary advices, or refer them to specialists who will take care of their physiologies and their hormones or whatever it is to achieve that goal. So it's not just liposuction that will be able to achieve that goal, it's the whole management that will help.
So it could be done, but it requires many components put together.
Absolutely.
And liposuction is part of it.
Is one
I
of
would
them.
say is the one that puts the icing on the cake.
Absolutely true.
What are the latest technologies in liposuction? Because in so many areas you read something like traditional liposuction and VASA liposuction and laser-assisted liposuction, and I don't know what ultrasound-assisted liposuction. There are so many types today, so many of them. One of them is for high definition that leaves some men and women with like six-pack. What are the available types, and which one has superiority over the other, so people that can afford it would actually go and seek it?
Let me be very honest with you, okay?
Please do.
See, the science is removing fat. Okay, that's the science.
Yes.
Now, removing fat means liposuction. How can you remove the fat? By sucking it out.
Sucking it out,
Okay.
yes. Yeah.
Any other technology that is out there in the market is to help make the fat easier to remove. Okay? It's not going to remove the fat or reduce the fat, the technology. So our goal is, when we want to remove the fat needs to come out easily, without bleeding, okay, without causing a lot of bruising and after effects or side effects or complications.
Or even the skin sagging.
Or the skin sagging. So what we do is we combine it with technologies. For example, VASA, which is ultrasound, is my favorite. Why it's favorite? Because it very gently breaks down the fat melts it, and makes it easier to remove it.
Yeah.
But having said that, I don't use Wageda to melt the whole fat. I cannot, because it will take me hours to do that. Okay? And it may not be able to completely melt the fat. So it is used in a strategic position where I know is a bit troublesome area where it could bleed more or the fat is tougher.
Yeah.
Okay? In those areas, I will use Wageda, and rest of the areas, it is still liposuction that I'm using. Then, if I see that the skin is a problem, okay, and the skin will not contract as much as possible.
Yeah.
I mean, there are technologies, but honestly, at this day, I still do not rely on those technologies. You cannot predict the skin tightening with those, and you cannot promise the patient a certain extent of skin tightening. You cannot.
Yeah.
There's not enough studies or research to tell you how much percentage of skin can be retracted. So honestly speaking, we are still experimenting with those technologies. Be it J-plasma, be it Renovion, be it laser, be it whatever other technology. So liposuction still is the basic procedure. Unfortunately, it's called as traditional, but yes, it is traditional. But it's done in a better way now than it used to be done 20 years ago. It is safer now than it was before because the tools are easier. Yeah. The anesthesia part is easier. The medication that we use is different than what we were using before. And of course, it's the skill of the surgeon that gives the result.
Indeed.
Six-pack, I don't need Wageda. I don't need J-plasma. I don't need any technology. I just need these hands. And the understanding what I need to do to give that person a natural six-pack. Yeah. So that's the fact about liposuction.
And do you sometimes have to treat sagging skin after removing the fat from certain areas? And if it is to be done, like for example, love handles, you have removed the excess fat, and then the skin is sagging. In the same setting, the same time where the patient is on the table and still sedated, do you tighten the skin with another procedure?
So the most important thing is first to predict the skin tightening. This is a skill that a surgeon needs to acquire.
An experience.
An experience.
Yes.
What skin will shrink and what skin may not shrink, or what skin will just partially shrink. Okay, and it depends, of course, on the age of the person and the body type and how much fat one is carrying. So during the first consultation, before even we decide or plan surgery, we have to give a plan to the patient. That look, I will do liposuction and I expect that the skin will shrink. So it should, obviously with the skill and the experienced surgeon, should be the outcome that we predicted. Okay? Or we may see that there is a problem of smooth leg skin which will not shrink. Even if I do all the liposuction, it will not shrink completely, or will just shrink 50%. Then I have to give them options for that. That if that happens, I might use some additional tools or technologies, like let's say, for example, experimenting with J-plasma or Renovion, or after the liposuctions, we use external machines like Vela Shape or LPG or whatever, or remove the skin or cut the skin. Which is like the body lift or the tummy tuck or whatever procedure it is. So that needs to be predicted beforehand. This is a decision that we cannot change when we are doing the surgery.
Yes, understood. Going back to liposuction and fat transfer and removing the fat, I am going to take this to the next body part that, again, one of the most sought after body enhancements, which is breast augmentation. What are the available augmentations now? What are the available parts now that women can go to a plastic surgeon to achieve the most naturally looking breasts? Because I recall back in the days when it started, you look, especially on TV, when women are very proud of it and they want to show the cleavage, there is no cleavage. You can see that they have a breast and it's not moving because the implants are that hard. What are the implants now, and would you suggest if anyone is to go for liposuction to have a fat transfer to enhance the breast, or use an implant and outside piece?
Yeah. So between implant and the fat, I would still prefer an implant than fat. The reason is implant is still the most predictable way of enhancing the breast. If I want to enhance a breast from a certain size to a certain size, let's say from an A cup to C cup, I can do it with predictability with an implant.
The size of the implant and the positioning, you know what will happen.
I cannot with the fat. Fat would be unpredictable.
Yeah.
Fat is very useful to reshape the breast, particularly for people who are born with certain problems in the breast, like one of the conditions is called tuberous breast, where the shape of the breast is abnormal.
Yeah.
So in abnormal shape, you can improve the shape of the breast by doing fat grafting. So in such situation, I would say fat grafting is a good option. But somebody who has a normal breast or needs a significant increase in the size, then implant is the most predictable way. And of course, the implants have improved now. The quality is much better. They are more softer. And it also depends on what size one uses. A very large implant, no matter how soft the implant is, will eventually make the body part hard.
Because you're stretching the skin.
Absolutely. But if it's a reasonable size, which is covered nicely with the body tissue, will continue to remain soft for long time, if not forever.
What's the softest and most natural material of an implant that's available today?
So it's still the silicone, although obviously there is a lot of fear and there's a lot of negative emotions for silicone, but silicone is still one of the most biological product that is used in many parts of the body and been used for maybe hundreds of years. But silicones are of different grades. Of course, it needs to be medical grade. That's the most important thing. Second is it can be of different softness. So we call it as type 1 cohesiveness, type 2, type 3. So type 1 is very, very soft. Type 2 is a bit more firmer. Type 3 is a bit more firm, where one needs to give a shape to a chest which does not have any shape. So those are more firmer. So there are implants which are much, much softer now. And in fact, there's also an implant which is also lighter in the weight. So it doesn't feel as heavy. But it's still a new implant, and we're still trying to understand the long-term effect of that. I'm hoping that it will be a good option.
Once the implant is there, in place, in position, of course, each one will have their own aftercare after doing it, depending on age, the size of the implant, and the incision itself, which is another question about inserting the implants. Once this is done, Dr. Sanjay, the person who's done it needs to come back to you for a recheck after 5 years, after 10 years, or once it's put there, that's it, it's done for a lifetime. This is another confusion for many people.
It's very important. Anybody who has an implant needs to be checked on a certain period basis. And the protocol, which is an international standard now, is to have it checked, of course, for the first 2 years on a regular basis, which could be every month, 3 months, or 6 months. But after 2 years, it needs to be checked every 2 years. After 5 years, again, it needs to be checked after 10 years. And every time they go for checking, the doctor may advise them to do an ultrasound or even an MRI to make sure that the implant remains intact. So implant is not considered a permanent device. You cannot have it for the rest of the life. It needs to be removed at some point of time. And usually now the international standard is 15 years.
Why does it need to be removed?
It's because any device will have wear and tear.
Yes.
And when it's inside the body, there are a lot of forces that is working on the body. And that's why it's very important the size of implant. A size which is reasonably good, sits comfortably underneath the breast, does not go a lot of wear and tear. But the bigger size implants in a smaller chest tends to undergo a lot of strain and stress. And that deforms the breast, weakens the breast, and has its own risks and complications.
Where is the best place to get the incision done for the implant?
I feel the best is underneath the breast, which we call as inframammary. Okay, I've done from axilla, I have done from the nipple area, but underneath the breast is the best. The reason is there is more control for the surgeon. Risks are less. Okay, it's a quicker procedure and more predictable outcome. In any other position, there are a lot of variables that are added which may not go the way what we or the patients want. Sometimes we do from around the nipple area if an additional procedure is done, like a breast lift, for example. In those situations, it is fine to do it from around the nipple. But I would prefer underneath the breast.
Does it affect the woman's ability to breastfeed?
Again, very interesting question. It all depends on the size of the implant used. Of course, one thing is important is whether the breast to begin with has the capability of breastfeeding or not. That needs to be determined. Okay?
Yeah, but it might not be known before
It
the
is
first
difficult.
baby arrives.
It is difficult to know.
Yeah.
It is difficult to know. But putting an implant, how would it affect breastfeeding? One, if it damages the nerve, which provides sensation to the nipple, which is important to generate that reflex for milk production. So all the plastic surgeons are aware and they do all the best effort to prevent that damage. Okay. The second is when the implant is so large that it is compressing your breast tissue. When there is a continuous pressure on the breast tissue atrophies or becomes smaller, becomes thinner or dies. And they will not then be functional. So if these two things are avoided, breastfeeding will not be affected.
And how about the scarring after doing it from under the breast?
So there is a scar. There is always a scar. Sometimes the scar is very good. Sometimes the scar after a few years is hardly visible. Sometimes the scar can look darker. So that also we have to predict to begin with. If for any reason we doubt that the scar will be as good as we expect, or because the nature of the scar in another part of the body is not good, we actually deny the surgery.
Especially for people that form keloids.
That forms keloids or forms dark scars. What has improved over a period of time is the size of the scar has become smaller from before because we use a special device to insert the implant.
Yeah.
So the size has become small. So it's not instead of this big, it's smaller now. Yeah.
For if they develop problems around the scar and they come back to you, do you cut the area or do you treat the scar itself?
So you can, it depends on how long it has been. I usually, if it is within 1 year, then we treat it with lasers or sometimes we inject to make it soft.
Steroids.
Or we use silicone sheets. But if it is longer than one year, it's best to revise it. Now the reason is, again, this is very important because if you're trying to put a big implant, okay, to a small incision, what will happen is that stitch line is always under tension. And that scar will not be the best scar.
Yeah, definitely.
So, yeah. So in those situations, we wait for a year, 2 years, where the skin becomes softer, it becomes more, let's say, lax. Then we can remove the scar and just adjust the skin and make the scar finer.
But this is going to make the skin stretch again because it's going to be removed, this part. And
No,
you
so
have to
it's,
bring this.
yeah. So the primarily why it stretched because of the implant, because it was suddenly stretching the skin. Over a period of time, there's no sudden stretch. So then when we remove the skin and bring the skin together, the stretch is not as much as it was the first time. So it has a better opportunity to heal finer.
Got it, because it was already big inside the skin, so it stretched the skin
Already the
from
skin
within.
is stretched, so it's lax enough for it to close.
But with this, would stretching the skin or would having a nasty scar be a reason for a woman to rethink about the size of the implant?
Absolutely, I would say that. They should definitely consider these things. So what happens is, unfortunately, many times people just think about how they would look on their dress and how would the cleavage appear and, all of those things, but they forget about other things, and which is what the surgeon is trying to explain to the patient. Sometimes they are able to explain, sometimes they are not able to explain, or convince enough.
Yeah, because what they want is what they want. Like she saw a photo and she wants that photo, or she might have a partner, okay, who would like to have her double D while she's already just a humble B. And this is what Dr. Sanjay referred to as pressure. And you, Dr. Sanjay, you assess the person's reasons for doing the surgery before you actually do it, correct?
Absolutely.
So if you determine that the reasons are not right or will not, what you will do is not going to fix the problem, do you convey this to the patient and give it to them straight that you're coming here with all the wrong reasons?
I'll tell you certain circumstances.
And
What
they will
happens
never
is
be
sometimes they come as couple, and that's the most difficult consultation that I have. When one of the partner wants a certain way, whereas the other person wants a different way, that becomes a very, very difficult consultation for us. But yes, during that consultation, what I do is I explain to each one of them the pros and cons of whatever procedure or size or whatever that needs to be done. And then I encourage them to come back for a second consultations. And I do give them a hint to come by themselves without the other party. Without the other party. Yeah. To then ask them and understand, is this what really they want? And many a times I have found they said, no. It's just the pressure that they are going through. In those situations, I tell them not to. I tell them go back, discuss with your partner, and if they're convinced, if both of you are convinced, then come back.
Right, and that would be the best course of
Absolutely.
Making a decision about it, because sometimes those decisions are irreversible.
Yes.
So, Dr. Sanjay, you get the couple that come in with one party wants a specific result and the other one might contradict that result. One of them is trying to set the expectations correct and the other isn't, accepting the fact that his or her expectation is not right. And you need to bring them in separately. How do you set the expectations correct with either of them? And try, but is it going to be by trying to convince one to manipulate the other, or you try to bring them in the middle so that things move forward smoothly? What's your trick?
So when I do the first consultations, I allow both the partners in, okay, and I try to understand each one of them. So the patient who actually needs something, I would understand her or his need, and I would at the same time also try to understand how supportive the partner is or not supportive. There are instances where I get to see that they don't want that partner to do anything, or they want the partner to do in a certain way which is different than what the person or the patient is expecting. This is very important assessment that I have to do in the first 30 to 40 minutes.
Right.
Okay. After that, I just explain to them the pros and cons of staying within a norm or going beyond the norm, whether one or the other party agree or not.
Yeah.
I just give them the fact about the procedure. If I see that during the discussion, and mine is more interactive discussion, I will discuss with them. I will not just keep on speaking.
Yeah.
So I ask them, so what do you think? And if I feel that there is some agreement, then that's very good for me. If I see that there is no agreement, then I tell them, go home, think about it, discuss, and then come back. If I feel that there is an unusual pressure from the other partner, I would prefer that partner not to be there in the second consultation, so I understand this patient. But if I see it's just a matter of understanding or expectations, then I bring them the next time and I ask them what have they decided, and then again I try to assess them.
Yeah.
But this is the time when I give them a medical advice, that this is what I can do, this is what I cannot do.
Yes. This is what's going to look good, this is not going to look good. This might carry risk, this might not be a wise decision that will have implications later on. Well, I hope that most of the time they listen to you.
So many times they listen, sometimes they don't, and unfortunately I have to deny surgeries to them.
And they go somewhere else and do it.
Well, maybe.
Then they come back to you.
Sometimes.
This part was for the maybe breast reduction. No, that was for the implants. Now it's about the breast reduction, and breast reduction is not just for male, it's also for some female, as the breast sometimes puts their own health at risk, and sometimes is not aesthetically pleasing because proportionally is wrong. So when we talk about breast reduction in female, does it go through the same procedure of having the same size of scar and everything? Is it more like a liposuction? Do you need to use implants after that to treat the sagging skin? This is a question that I really want to know about.
So, unfortunately, breast reduction involves much more than augmentation, which means it's a bigger surgery, it takes longer time, there are more scars. So it needs to be very carefully decided whether that person would really benefit from that surgery or not, considering that she will end up with some scars, which may be great scar or not as good scar. So it depends on what she's suffering from. If the sheer weight of the breast is causing physical problem, neck problem, back problem, then yes,
breathing
scars
problem
do not,
sometimes.
and breathing problem sometimes. Then scar does not matter as much.
Yeah.
Obviously, always the goal and aim is to minimize the scar. But then they will have scar around the nipple, they will have a scar which runs down the breast, they will have a scar underneath the breast. But at least the weight is taken off, the size and the shape improves a lot. So we weigh the pros and cons of the procedure, risk and the benefit. If we feel that the benefit is significant from health point of view, then the risk of scar is not a big deal.
Yeah, because it becomes a health hazard, keeping them. Yeah.
But on the contrary, if somebody who is very young, has not got married, and has some weight in the breast, I would be very, very conscious of advising surgeries to them. Because unfortunately, the community that we live in or the world that we live in, it's not just her own desire, it's a family matter as well. So it's a very, very sensitive.
The future partner
matters as well.
Yes.
So it's very important for me to then analyze and explain to them or defer them surgery until they get married. Unless the problem is so severe that they are incapacitated. And I've seen that. I've seen 16-year-old, 17-year-old with massive gigantic breasts. And I think it is fair in them to reduce that and give them that confidence back.
Indeed, indeed. Because sometimes, unfortunately, with the youngsters, they might actually get bullied over something like this. And this is known in schools over the physical appearance, especially with the social media. How about male breast reduction? I know that this might not be a health hazard as it is an aesthetic inconvenience for a man to have a B cup, breast moving around with him, especially if they want to go to the pool or the beach and they want to just be topless. Is it the same thing as female? We're going to have the same scarring and the same issues?
So you're right. This is not a physical concern in most of the situation. Very rarely, unless it's really massively enlarged and causing skin problems and things like that. Most of the time, it's psychological. It is about their body image. It is about the fact that they want to go to the gym, remove the shirt and exercise, or go to a pool or beach and remove the shirt.
Yes.
So in these patients, we have to minimize the scars. We have to make it in such a way that they are able to remove the shirt and they are able to do what they want to do. So these procedures are more, let's say, keyhole procedures, minimal invasive procedures where we remove the gland with very tiny incision. If there is fat tissue or soft gland, we break it with technologies like ultrasound or laser. In some circumstances, only when the skin is really excess, that we have to remove the skin.
Yeah.
But unfortunately, in those situations, they do end up with some scarring. So normally, let's say grade of 1 and 2, which is not significant, we can just make a small, tiny centimeter and a half incision, and that's done. And it's not visible.
Nice.
But if there is more than that, where it's sagging and the nipple needs to be reduced in size and lifted, then there is a scar around the nipple, which is also not too bad in most of the situations because it's just within that perimeter. But in some cases, it has to be like what is done in women, which is removing skin from here, removing skin from there, repositioning it, and they end up in multiple scars. So that actually defeats the purpose in many situations because they are again not able to remove the shirt when they go to gym because of the scars.
Yeah.
But at least they are happy because they can wear comfortable dresses, tight t-shirts, and
when it's
go
covered,
out.
they
So,
have that confidence in them that they don't have feminine appearance.
while they are dressed or while they're wearing certain kind of dresses.
Indeed, but you also mentioned, Dr. Sanjay, that even if there are scars, there are multiple treatments and procedures that are available nowadays. The only thing is your set budget for the procedure is going to increase because of the possibility of trying to treat the scarring afterwards. Moving from the breast, I would like to ask about the Brazilian butt lift. The butt lift, Brazilian butt. It's called something, okay?
Yes, yeah.
And Dr. Sanjay, whatever we're discussing today, most of it became a trend, to be very honest with you. Like I was around from the days where it was very normal for people to go and ask for rhinoplasty, very, very normal, for aesthetic reasons, not just because they have a problem. It's very normal to go and ask for breast augmentation, liposuction, definitely. But with the fillers in the lips, the fillers in the cheeks, and the fillers in the jaw, and the implants even in the face to look like someone, came the overdone butt lift. My understanding, butt lift is where some mothers or some ladies, actually, even if they're young, they have sagging butts, and they want to have the butt lift to have it look firmer. But today, butt lift became about putting implants, fat transfer, okay, and having it inflated in a massive way that looks more like some of the most famous celebrities. So the question is, do you think that this is a trend that is going to fade?
Yeah, definitely it's a trend, okay? And we have seen the trend rising. We are seeing the trend going down now. And let me begin with what actually BBL is, which is Brazilian butt augmentation. Let's say BBA, not BBL. It's different.
Yeah.
It was for some of those people who had problems. You're right. Some of them who had changes in the buttock shape because of weight loss, because of pregnancies, because of different reasons, or just because they were born with it, you know.
Yes.
So it was to correct those problems by adding some fat, maybe even some filler in certain area, just to fill up those defects and make it more aesthetically better.
Appealing, yeah.
But then it became a trend where people wanted more and they wanted more and they wanted more, to the point I have seen that it has become massive in certain people. And then I have seen many patients, and I have actually done many patients where I'm undoing it now by removing what has been put inside. So, to some extent, it's fine. BBL or Brazilian buttock augmentation is a good procedure to improve the shape of the body, to make it more proportionate, or putting even an implant in a person who do not have any, let's say, projection or contour is fine.
Yes.
But beyond a certain limit, it can be dangerous. And again, it can be irreversible in many circumstances.
Irreversible.
Absolutely.
Irreversible. Going back to this is lifted and this is inflated and this is deflated, and I have seen on Botched that some people go to the plastic surgeon to ask for some ribs from the rib cage to be removed so that they can have that hourglass figure. Did you do it? Do you do it? Do you accept it? Do you agree on doing it? And do you say that it's risk-free?
I personally don't do it. I have learned the technique. I have researched the technique. there are two ways. Let me tell you what it is. The two ways. One is to remove ribs. And it's not just one rib. You need to remove at least 3 ribs to give that shape. Yeah. And what's the problem of those 3 ribs removing? It takes away the protection of the lung.
Of the lungs, yeah.
In that area and makes it vulnerable. Or now they have improved it, they've modified it, where they break the rib, okay, and mold the rib, which sounds less traumatic, but to be able to achieve that, the surgery has its own risk. But to get the result, they have to wear a tight wear for 3 months so that the rib heals in the newer position.
So they live for 3 months with broken
absolutely with a tight fitting corset to make sure that the rib stays there. If they don't wear it, won't stay. It'll
Does
just
this
go back.
apply any pressure on the lungs?
It can have a lot of consequences in the organs, body organs. So in my heart, I don't want to do that procedure.
I wonder if it's
technically
worth
I want to know it.
Of course.
You know, so I can explain to the people.
Yeah. But I don't know, from what I just heard, I don't think it's worth it, especially when it might be a trend. And trust me, this time I know that it's irreversible.
It is. It is.
We're talking about your own bones here. So having a trend going up and a trend coming down, and this some sort of procedures are, thankfully, due to the moving technology the whole time, so many procedures became reversible. And this is where we advise again and again to go to an experienced doctor, which brings me to this very important question for Wageda and for every single person watching this podcast with us. Dr. Sanjay, how would someone go and research a good plastic surgeon to know if this is the right person to knock on the door or to move away from there, especially with the vouchers and the discounts and the massive offerings that come from other countries without naming the countries? Okay, that you go there and you get, I don't know what and what and what, a full mummy makeover for like $3,000, which is very, very so not realistic. What should we know about the plastic surgeon that we need to go to, and we need to know if this is the right one or this is the one to cross out of the list?
I think, and I tell everybody that you should have a checklist. You need at least 4 or 5 things. One, you need to go back and research about the doctor, about his or her credentials, where they have qualified from and how many years of experience they have, and whether or not they have that expertise to do that particular surgery or not.
Yeah.
That's number 1.
Yeah.
Number 2 is talk to people who have undergone the procedure. I can understand that it's a sensitive issue, not everybody may want to speak.
Yes.
But sometimes in the circle, it's always a good idea to ask for the credibility of that doctor.
Yeah.
And many a times, particularly in UAE, Dubai is such a small place that it's very easy
everybody knows everybody.
Everybody knows everybody.
Yes.
It's very easy
Yes.
to know the credibility of that person.
Yeah.
Third, obviously Department of Health has their own websites where they have all the qualified doctors listed in there. Make sure that these doctors are there in that. And they have international membership which gives them credibility based on their experience and their qualification.
Yeah.
So they need to be listed in, let's say, International Society of Aesthetic Plastic Surgeon, or let's say American Society of Plastic Surgeons.
Certain fellowship here and there.
Yeah. Or societies of the countries, for example, European countries or any other countries.
Yeah.
You know. So I think these 4 or 5 things are very important to make a decision. Not the cost, not the convenience, not the fact that they will look a certain way, or what is projected in the social media. Not that. Certainly not that.
If it's too good to be true, it probably is.
Not.
And I remember about 6 weeks ago, I have seen on Instagram, basically there was a specific surgeon in a specific country. It's a hospital or a clinic. They were advertising wrong and false photos that were photoshopped for human beings before and after facelift.
Yeah.
That they got everyone wanting to go there, and someone exposed them. In less than an hour, the entire site was gone.
Yeah.
And some people, even the patients that they put the photos for, looked at the photo and they're like, I am this person and I didn't do the procedure and this is me.
Yeah. And let me tell you a sad fact. One of the sad fact is there are brilliant surgeons. There are so qualified surgeons that we have here. They're so experienced, but they don't have the skill of being on Instagram or a TikTok or a Snapchat or any of these things.
Yes.
And they just get lost. They cannot. At the same time, we have to actually sometimes do things that we don't want to do. And I'll tell you, I'm the victim of that as well. I have to keep it up, on the Instagram. I have to be.
Yes.
I have to be public speaking. I have to be on Instagram. I have to be on Facebook just to prove myself. I think that's so wrong.
So that we can see
That's so wrong. Exactly.
Yes, I totally agree with you, Dr. Sanjay, especially, and unfortunately, the new generation of doctors, with all my due respect to everyone, those that don't have many years of experience under their sleeves are actually the one, they grew up with the social media and they are the ones that actually have taken the social media by storm with their presence and their smiles and their big talk and many promises, while the people, the actual real experienced surgeons, are busy in the operating room or doing their research or getting more education or getting their more skills in doing things. So please do not believe everything you see and do a good research. One of the things that I want to ask you about, and I noticed it multiple times, you go to a doctor, like I for one, have done the laser, the stem cells and everything, and before I left the clinic, I made sure that the doctors and the nurses know that my name and number are available for every single patient coming for the same procedure and would like to speak to one who's undergone it. So why is it difficult when I go to a doctor to say, can you please show me some results of what you did before? Why am I always getting the answer of, no, the patient didn't want us to take photos? Yet, when I go for any procedure, they have to take photos and document it, because just in case anything goes wrong, they say, no, this is you, this is the before. Why is this, and how can we overcome the problem of doctors not willing to share their results with their potential patients?
So one of the important thing is, of course, the patient confidentiality that we are all worried about. So obviously we do take pictures, and that's for medical legal reason, before and after. And we do try to take permission from the patients, whether they allow or not. I would say, let's say 2 to 3% patients, particularly in my practice, they agree to do that. So I think if they agree to do that, I would actually make it available for other patients, because the purpose of consenting is to educate others. That's the purpose of consenting. They have given consent because they want us to educate other patients. So I think one should have an experienced doctor or a surgeon who has been doing surgery for many, many years, should have some case studies to be able to share to the patient. Having said that, it should not be misinterpreted by the patient as well. Because when they see a result, and obviously the result that is shown are the best results. They may not be average results. They may not be suboptimal results. Okay, and that's the fact. So the expectation rises up. When they see an exceptionally good result, they expect the same. So, to be fair, what I do sometimes is I actually show them good scars and bad scars. I show them that it could be as good as this scar, but there is a chance that it could be this scar. If this scar happens, then these are the things that we have to do to treat them.
Yes, setting the expectations right.
Yeah. And I also like to show them surgery, pre-op, immediate after surgery, or a few months, and few years down the line, to show them that, look, what you see after the surgery is not going to be the same. It changes. Your body changes, and it all depends on your lifestyle. Some people are able to maintain the lifestyle, they have a result, great result for 4 years, 5 years, 6 years. Others may not. So I think it needs a lot of guts from doctors to be able to share that.
Yes.
But I think it's fair to be shown, and I think it's patient's right to know what to expect.
And it is also our responsibility to understand that what worked for one might not work for others.
Yeah.
I have seen some people that used CO2 fractional laser, and it worked for them, and so many others had it actually worsen their skin. So what might work for one patient not necessarily will work for the other. So it's all about setting the expectations correct,
Yeah.
and researching the doctor, and please don't look at the price. Dr. Sanjay, one of the most fascinating things of one of the most sought after plastic surgeries, and I have to say plastic surgery because it's the rhinoplasty. Some people need it for health reasons, as broken whatever, trauma that happened and they need to fix it, but now it's the trend again. No, the trend began many years ago, to have it looking like this celebrity. I want this nose. Rhinoplasty, when you do it, where are the scars? Do you actually remove bones from the nose? And how long does it last before the person has to come back to you for another reshaping?
So rhinoplasty nose job is particularly for reasons like the rest of the body. If it is disproportionate, somebody has a hump on the bone or has too big a tip of the nose.
The falcon nose.
Yeah. So what rhinoplasty is, the purpose of it is to reduce that and make it more proportionate, and that's good. The results are good, and these results do last long. Okay, I
But
cannot
not
say it's
forever.
permanent. I cannot say it's permanent because nose also changes with age.
Yeah.
The
And
nose tip drops, the nose becomes thicker. So these things do happen with age.
And we lose the support.
And we lose the support. Right. Sometimes we remove the bone, part of the bone, like the bump or the hump.
Yeah.
Sometimes we remove the cartilage if it is blocking the nose or making it deviated or sticking out too much.
Yeah.
Sometimes we add bone or cartilage. More than bone, it's the cartilage. So we take the cartilage from ribs and we add it just to
Sometimes
build it
from
up,
the
sometimes from
ears.
ears to build it up. Very rarely we do use like silicone products or certain other prostheses or implants to add the volume
The
to the nose.
volume that is
Yeah.
needed, yes.
Yeah.
Yes.
But the bottom line is, I wouldn't do to change the structure of the nose to look for somebody else because it's not possible. Every framework is different, every face is different, and a nose is not just nose, it's part of the face. And it needs to be treated like part of the face, which means it needs to be harmonized to the face. So definitely I don't do that. But in my experience, most of my patients actually, maybe I'm lucky, they don't want to look like somebody else. They want a subtle change which people will not notice, yet they would find it attractive. So a large number of patients that I am seeing are actually asking for subtle rhinoplasty, which is very interesting. And I think it's because of they've seen in the media of botched nose and abnormal looking nose that people are now changing that. And the scars can be hidden. It's called closed rhinoplasty. It can be all inside, so you don't see anything at all. Or it can be an open tip where there's just a small scar which is at the bottom of the nose. And that also in many circumstances is not visible. So it's customized on individual needs.
Actually, I remember seeing that scar on one of the Arab celebrities, female, and most of the female, unfortunately, they have the nostrils pointing up. So you look at them and you don't see a nose, you see nostrils looking at you. And so many of them, we have noticed over time that their skin on the face, it sags. So they go and do fillers, okay, to plumb the skin. and the nose becomes that size. Which makes it not just out of shape, it makes the face looks like animation, one of those anime characters. Now, rhinoplasty is maybe reshaping, remodeling the nose. Those that have the nose now looking too small in comparison to the face due to the fact that they have undergone rhinoplasty to make it smaller multiple times. Can you make it bigger again to be in a good proportion in comparison to the overall face?
It's very difficult. Very difficult. Why is it difficult is because once the nose becomes small, the skin shrinks. And if it has been done long time ago, the skin becomes tight enough not to stretch again. So there is a limitation. To some extent, it can be improved. You could add maybe a cartilage or some implant to stretch the skin, but to stretch beyond a certain limit is difficult. It's impossible. And it's risky as well.
And the scarring that is here, could it also be treated like the other scars on the body?
Yes, it can be improved. The scar can be treated, and it's most often by surgical correction than laser, particularly the scar at the bottom, because the scar is visible not because it forms bad like keloid in the body. Nose doesn't form keloid. It's mismatch of the skin that looks like a scar.
Yes.
So you need to do a little redo procedure to match it again, to minimize that scar.
Brilliant. Got that. Speaking of, my last thing is going to be the mummy makeover, because again, this is something that I started hearing about a good number of years ago. It was not there before, but now it is available. Dr. Sanjay, what is mummy makeover? Like when she comes to you and she does what exactly? It's a makeover.
So mummy makeover is just to correct some of the changes that has happened because of pregnancy. And of course, the commonest thing that happens is the tummy. Because of pregnancies and deliveries and cesarean sections, they do have loose skin, the muscle stretches out and things like that. But there's also changes in other part of the body. For example, breasts, because of breastfeeding, because of weight gain and loss.
Yeah.
So they may have sagging, they may have reduction in volume. So the commonest mummy makeover procedure involves tummy and breast surgery, like a tummy tuck or a breast enhancement or a breast lift. Sometimes there are additional procedures like removing a bra roll, which annoys women sometimes when they gain weight after pregnancy.
Yes.
Or they may have, the hips may become too big because of pregnancy.
Yeah.
So then there is a combination of procedures like body contouring, liposuctions with tummy tuck, breast surgeries. Usually it is in these regions that they do combination of surgeries, and that's what is mummy makeover.
When a patient comes to you with certain expectations, like she wants to go to be looking the way she looked when she got engaged to her fiancé, who became the father of her kids, her children. Dr. Sanjay, do you do the makeover in one go, or she comes back for each and every adjustment of that part, the affected part in the body?
Yeah, I think it's very important for people to understand. Now, tummy tuck does not mean that one becomes like what they were before pregnancy, unfortunately. They do not.
Okay.
You can again correct to some extent.
Right.
It again depends on how much body changes have occurred. If there is minimal body changes, then yes, there is a possibility that removing that skin could be a one-time procedure, and then it gives them the result that they're looking for.
Right.
But in most of the situation, it's not. Because they would have gained weight in different areas of the body, they would have gained inside the tummy, which cannot be corrected in one go. And like I said, there is a safety limit. So you have to do whatever is safely possible in one go. Then sometimes there is always a need where if they want to make it better and better, you may have to do a few other procedures to improve that.
Yeah.
Like doing some more liposuction, like doing some more, let's say, enhancement, or little tucks here and there.
Yes.
Yeah.
Yes.
So there is a possibility that they may have to do if they really want to look as good as they were before.
And it might be multiple visits, not just in one go. You can sedate them for 36 hours. And
Absolutely not. That's a big no-no.
Dr. Sanjay, what is the maximum number of hours you can sedate a human being?
Well,
I know
okay,
that you
that's
can
a very
stand
difficult
and work for
question.
16 hours,
That's
but
a very difficult question, but it's my principle, my policy. I do not keep the patient under general anesthesia for more than 4.5 to 5 hours. That's my
Right.
policy.
right.
That's my policy for last 20 years,
Yeah.
and that has kept all my patients safe.
Yeah.
But again, I don't know the number of hours that the person can be under anesthesia or sedation.
Yeah.
It really depends on the function of the body, depends on so many different factors.
And the age and,
And the
health
age
condition
and the medical conditions and the facilities available and so on and so forth.
Yeah.
I think
Yeah.
best is to stay within the normal limit range.
Yes.
And in my experience, and the literature also says that, particularly in plastic aesthetic surgery, a surgery that goes beyond 4.5, 5 hours has higher complications. And that's been documented.
Right, I got you. So you would basically understand that you are going to go in and have the procedure that is going to be done in the 4.5, 5 hour stops. And you prepare the patient that only this can be done today, correct?
Absolutely. So I will have like a menu.
Yeah.
I will plan 1, 2, 3, 4, 5 steps, and I
Yes.
know that I will finish this in 4, 5.5 hours. I would not add a 7 or a 6 or another number to that at all. And I would rehearse the surgery before going in for the surgery.
Yeah.
So when I go in for the surgery, 1, 2, 3, 4, 5, 6, and I'm done.
Yeah, and you have a briefing with your team as well and the
Absolutely.
assistants, and you know, so that you're moving as fast as you can to cover as much as you can
Absolutely.
within the given
Absolutely. Absolutely.
time. Dr. Sanjay, this part of the podcast is going to be funny, but at the same time, many of the viewers are going to count on what you say because it's called Mythbusters.
Okay.
This is something that we all believe has happened or it will happen if I do this. But you are here to correct our misconceptions. If it's wrong, it is wrong. You're going to say why. If it's right, then what we believe in continues. Exactly like I asked you about the breast implants, if they can affect the breastfeeding, yeah, for the mothers to be, which turned out that it could be a yes, but it also could be a no, and it depends on multiple factors.
Correct.
And this is where for breast implant we go to a very well experienced doctor. Let's go for the myth number 1, to try and bust it. Plastic surgery and cosmetic surgery are the same.
They are not the same. Plastic surgery is a broad specialty that includes reconstructive surgery as well, whereas cosmetic surgery or aesthetic surgery is only done to enhance an appearance.
Plastic surgery turns you into a plastic doll.
That's absolutely not true at all. Plastic surgery does not mean that we use plastic every time. Plastic surgery does not mean that we make them look like a doll. Plastic surgery just means that we correct a certain part of the body to improve form and sometimes function.
But some people did looking like a Barbie.
There's always exception to the rule.
You'll come out of a surgery looking like your favorite celebrity. If only you picked the right surgeon.
That's not true. You will never come out as a celebrity if you are not a celebrity to begin with. Celebrity is something different. Obviously, you could come out with a better body and obviously with more experienced surgeon. So that is true.
I personally know this. I heard about it many years ago. Breast implants can explode on planes.
That's absolutely not true at all. At all.
So there is no way that they will ever explode
No.
with the pressure and bits. Cool sculpting is as effective as liposuction.
That's not true at all. Cool sculpting can reduce some fat, but the fat stays inside, the cells stay inside. But many of the time, it does not work well. Sometimes it causes more increase in the size of the cell, of the cells, fat cells. So it's a big no-no for me.
You can get a tummy tuck immediately after childbirth.
No, you have to wait for at least 1 year. I always recommend to wait for 1 year to get the body back to the normal physiology and the physical shape, and then go for tummy tuck.
Plastic surgery is addictive, and one procedure will lead to the other, and they become plastic surgery addicts.
It can become addictive in two ways. One, in a good way, where you see the benefit of that operation, which has changed your life. You may want to do another procedure. But the not so good part is, if you just want to do it because you feel it's going to change your life or make things better, then yes, that addiction is not good.
Also could be a no, and it depends on multiple factors. Too many
Correct.
of my
This
questions
is where for
you
breast
said
implants,
yes, but
we
so
go
far
to a very well experienced
doctor. Said no to almost
everything
Let's
that we
go for
believed
myth-
in.
for,
Sorry,
thank you
for
so
the
much,
myth number one,
Sanjay, for
to try and bust
actually
it.
correcting our misconceptions
surgery
about
and
so
cosmetic
many things
surgery
related to
are the
plastic
same.
surgeries and cosmetic.
They are not the same.
Surgeries
Plastic
which we
surgery
should actually
is a
use
broad
the term
specialty
aesthetic
that
for
includes
it.
reconstructive
Not-
surgery
not
as well.
cosmetic,
Whereas
because
cosmetic surgery or
aesthetic
aesthetic
is
surgery
the
is
right
only
term to
done
be
to
used.
enhance an appearance.
And with this, plastic surgery turns you
have so
into
many
a
more
plastic
questions
doll for you.
That's
that
absolutely
will
not true
require
at all.
like 2, 3,
Plastic
4,
surgery
5
does not mean that we
podcasts,
use plastic every
but
time.
I will
Plastic
not
surgery
be
does not
taking
mean
much
that we
more of
make
your
them look
time
like a doll.
today.
Plastic surgery just
I wanna
means
thank
that
you
we
so much for
correct a
everything,
certain
and
part
thank
of
you
the
for the
body to
information
improve
and for
form
correcting
and sometimes
our
function.
knowledge about so
But
many
some
wrong things,
people did
and for opening
looking,
our eyes
like a
to the
Barbie.
fact that
There's always exception to the rule.
many things could be done aesthetically.
You'll come out of a
and
surgery
plastic-wise,
looking like your favorite
celebrity
without
ending up
only you
looking like a
picked
plastic
the right
doll.
surgeon.
Thank you very much. I really
That's not
appreciate. I
true.
enjoy educating.
You will never come
people,
out
so
as a
it's my
celebrity
great
if you are
pleasure
not
and
a
honor.
celebrity to begin
And
with.
I'm
Celebrity
open
is
to
something
any
different.
questions. You can
Obviously,
write to
you
me
could
and
come out.
you can
Load
always call me
on
back. I'll be happy to
planes.
answer.
That's absolutely not true
With
at
us
all.
here, right here,
At
is
all.
Dr. Sanjay Parashar.
So there's
and,
no way that they
did
will
I say
ever
the name
explode
No,
with
that's
the
correct.
pressure.
Sanjay Parashar.
Yes.
Okay, the chairman of Kakuna Clinics.
Cool
in Dubai.
sculpting
Is as
effective
we have with
as
us Dr.
liposuction.
Sanjay Parashar.
That's
He's
not
sitting
true at
right
all.
here. He's the chairman of
Cool
Kakuna
sculpting
Clinics in Dubai.
Can reduce
And,
some fat, but the fat
he
stays inside, the cells stay
actually gave me a
inside.
very good
But
surprise
most of many
at
of
the
the
very
time,
beginning
it does
of
not
this
work well.
episode, and
Sometimes
he said
it causes
that
more
he
increase
is
in the
going
size
to
of the cell,
dedicate some
of
of
the
his
cells,
precious
fat
time
cells. So
for
it's a big no-no for
5
me.
winners of
You can get a
something
tummy
that we're going to
tuck
be sharing with
immediately
you
after
later,
childbirth.
and he's going to give
No,
free
you
consultation
have to wait
for
for
the 5
at least
winners, and
1
the
year.
consultations will
I
be
always
related
recommend to
to
wait for
plastic
1 year
surgeries
to get
and
the body back to
aesthetic
the normal
enhancements. Correct,
physiology
That's very true.
and the physical shape,
and
and
all
then
the
go for
details are
tummy
going to be mentioned, and you will know how
Plastic
to be one of the
surgery
5
is
winners.
addictive,
And
and
one
one
procedure
procedure
will
Thank you very
lead
much.
to the other,
Thank you
and
very
they
much.
become
Thank you very
plastic
much for
surgery
every person
addicts.
who sat and tuned
It
in with
can
us
become
for this
addictive
podcast episode.
in two
Please
ways. One,
Do
in a
ask
good
all
way,
the questions
where you see the
want in the comment box below, and we will get back to you with the answers from the right source, and that source is going to be Dr. Sanjay himself. Thank you for watching, and I'll see you again next time for a brand new podcast with Wageda. Thanks for watching. Thank you. Yes, now is going